Health news this morning, half of all Americans will develop a behavioral health disorder in their lifetime, with 25% of adults experiencing some type of behavioral health issue every year. Most depression and other mental and emotional illnesses are treatable, especially if dealt with early. Joining us is Dr. Carrie Kraus. She's a psychiatrist and medical director of Mercy Health Behavioral Health to talk about anxiety and depression during the COVID-19 pandemic. Dr. Kraus, good morning. Thank you for joining us.
Thank you for letting me come on.
I'm so sorry, sir. How has the pandemic increased or worsened signs of behavioral distress? Obviously, a lot of us have gotten some anxiety due to COVID-19.
Anything that disrupts our normal routine is going to increase anxiety, I think. What has been a little bit surprising to me is at this point, we have not seen that many people coming through the system. And I think that's because they have been taught to stay home and to isolate and to socially distance. But I think it's out there. And I think the longer this runs, it's going to increase anxiety that people have, a sense of distress. And of course, these are huge disruptions in our society right now. Not only concerns about the virus and the medical effects, but also the concerns how this is affecting economy, how people are going to try to deal with the fact that they've lost their jobs. All of those things are obviously going to have huge effects on anxiety, and I think we're going to see that in the coming months.
I don't think anyone's been able to escape what you're talking about. You're right. There are different levels of anxiety from the minor to the major during this pandemic. So how can someone reach out for help?
We have been developing a unique system, at least unique for Grand Rapids, through Mercy Health Physician Partners, in developing what we call a collaborative care program. What anyone can do in the Grand Rapids area is contact their primary care physician if they have an MHPP or a Mercy Health Physician Partners physician. That physician will then be able to work with us in our collaborative care program. We have behavioral health specialists who are trained therapists who then are available through every office to be put in contact with individuals. They can set up appointments. We can speak with them. I'm available to talk to primary care physicians to help them if for some reason medications might be helpful. What we're trying to do is bring those services to patients and make it much easier to find them as opposed to individuals having to go out and find those services themselves, because I think we all realize it's become increasingly difficult to find behavioral health services. I mean, there are still traditional programs, and we're happy that we have Mercy Life Counseling in Muskegon. It's a long-standing traditional program that's been there. Primary care physicians with MHPP in Muskegon can either make contact with us, or they can certainly refer patients to the Mercy Life Counseling for additional assistance.
Now, are there ways that I can alleviate stress, anxiety, depression at home myself, and maybe even for members of my family, and help them out as well?
Well, you know, anxiety is a normal thing. I think what we look for is when does it reach the point where it interferes with the other things that you want to do in your life. Therapists will talk about something they call cognitive therapy. And there are techniques that people can do on their own. One of those, I think, is to look at your stress, look at the anxiety, try to identify, are there things that you have no control over? You don't have control over when social distancing may be eased, or you don't have control over who might get a virus, and find ways to let go of those thoughts and not find yourself thinking about them all the time. And for things you do have control over, make a plan, write things down. I think it's a lot better to write things down. It solidifies it in your mind as well as for other people. What is your plan of action for taking care of those things?
Isolation, obviously, very hard. PTSD out there as well for some people. When do we know when it's time to seek professional help?
You know, we kind of get accused in psychiatry of inventing a diagnosis for everything that occurs. I think the way to think about it is that if you're staying on, my analogy would be if you're riding down the highway and you choose the lane that you want to be in, and if you're doing okay with that, maintaining your lane, then you're okay. But if you find yourself in the ditch, you're going to need help. And that's where we're available at that point. If you feel like things have reached that point, where you just don't feel like you can handle it anymore. And I would say very specifically, if you're beginning to feel hopeless or if you feel trapped by your circumstances and don't know how you're going to get out of it, then please call your primary doctor. Please find some way to get in. You don't have to know what the solution is. We are going to be able to help you figure out what that solution is. But feeling trapped and feeling hopeless, those are danger signs for individuals.
Thank you so much for the information this morning, Dr. Kraus. Obviously very vital. Just a reminder, for more information about Mercy Health Behavioral Health, just visit them online at mercyhealth.com if it's for you or someone you know. Still ahead.